younger than their counterparts living in high-income countries. 1 in 4 heart failure patients in India die within 1 year of follow-up. Recent analysis of over 1 million people reveal that sitting more than 8 hours a day with no compensatory physical activity confers mortality risks on par with obesity and smoking. Those who remain seated for prolonged periods face significantly higher risk of cardiovascular disease and cancer compared to counterparts who move regularly. The average age of the first heart attack in India has been dropping every decade. It has reduced from 52 years in 2005 to 46 years in 2015 and to an alarming 39 years in 2025 as per the ICMR cardiac report. So why are heart attacks rising among young? The biggest trigger for heart attacks among young people are obesity, diabetes, smoking, hypertension. Sleep deprivation is also turning out to be a big factor. Another big risk factor, which I said, is diabetes, where India is the world capital. Nearly 1 out of every 2 patients rushed to a hospital with a heart attack triggered by a blockage of arteries suffers from undiagnosed diabetes, according to a study in the Global Heart Journal. Now let me introduce my guests without wasting any more time. I'm joined by Dr. Vishal Rastogi, Director Cardiology and Head Medical Advanced Heart Failure Program, Fortis Escorts Heart Institute, Delhi. Thank you so much, sir, for joining me.
Thank you.
And I'm also joined by Dr. Udit Dheer, Principal Director and HOD, Cardiothoracic and Vascular Surgery, Fortis Memorial Research Institute, Gurugram. Thank you so much, sir. Now, let me straight away go to Dr. Vishal Rastogi. Sir, smoking is the new, sitting is the new smoking, other lifestyle factors are there. But why is the age for heart attacks dropping, sir?
Yeah, that's a very valid point that you're raising, and I, on behalf of the entire doctor community, we wish everybody a very happy, healthy heart on this World Heart Day. So the problem with Indians, and this is a genetic predisposition that the Southeast Asians have, that we have this heart disease occurring younger than our Western counterparts. Though the data from India is not very robust, but the Indians which are living in the West, they have been tested about it, and they found that the disease is occurring faster. And it is not just genetic predisposition, but also because the lifestyle is changing, the affluence is coming, and we are now more and more focused about our career rather than our health. That's a big problem. Not only that, we are sleeping late, we are not getting enough sleep, and then we are eating all junk food, which is very readily available now just at a phone call. So all this is contributing to heart attack, which are occurring at a younger age.
Dr. Dheer, your opening comments as to why heart attacks are happening at younger age, and this sudden collapse which is also happening. I understand there's a difference between a heart failure and a heart attack. Most of the videos which I am showing is where the heart has failed. So, it's also making people worry. Why is this happening? Can you please unmute yourself, sir? Dr. Dheer?
Yeah. Am I audible now?
Yes, you're audible.
See, I totally concur with Dr. Vishal Rastogi regarding that. See, we have become pressure cookers without a vessel. Right from our school days till we are just driven by performance index. Okay, even I would say on social media, if someone posts, you have a stress that how many likes have come. That's also a big stress. See, we had that work hard and party harder. But I think that is changed completely. We work hard, we party hardest, and we don't sleep. We are in a rush, constant in a rush. Morning, you get up, you have earpods, you have a coffee mug in your hand, and you are having a breakfast, and you are driving a car and going to the office or whatsoever work. That is not life. Actually, we have to see our body in totality. We have to give rest to the body. We have to sleep properly, and whatsoever inputs what I say is, the inputs are from the food, from the habit of exercising and all that. And above all, de-stressing ourselves. life is not a 100-meter dash which we have to complete. It's a cross country. Everyone has a different highway. So run at a slower pace. I would say there was a dictum that eat more, eat less, eat more. Okay? Small helpings. Same applies to your heart also. De-stress it. Stress it to a limited with the exercise for 45 minutes. Then de-stress it with rest and laughing. See, I am a cardiothoracic surgeon and I repair a lot of mitral valves. So we do a water testing, and when we say that there is a good smile in the mitral valve, it's an adequate repair. So heart itself says that you should have a smile on your face. When the heart itself is saying, why not?
So basically you are saying there is a state of physical well-being, but heart is also about state of mental well-being, you know?
Yes. And I want to just not conclude with this. I would say, see, we are talking in English right now.
Absolutely.
Heart has only a different language. It can speak by increasing or slowing the heart rate, by causing pain, by causing breathlessness. Then it raises these red flags. Why we shirk? Why we try to find an alibi? That no, this could be because I haven't had a good sleep. So never negate your red flags. A timely intervention.
You know, I want to bring the conversation to this issue because people understand diabetes create problem, people understand obesity create problem, but there are two things, and that is why we are having this conversation, sir. Dr. Rastogi, sitting is the new smoking, first part. Why is that complicating? People say, "Acha, maine to 1 ghanta exercise kar li, now I can sit for 10 hours and do my job." Can you just decode it for the people why sitting creates problem for heart, you know? That's a new dimension that has come in. Can you just decode it for our viewers?
Yeah, so, as the smoking is going down, people are becoming more and more aware in the West. They realized that the heart disease is not reducing. So what is the problem? And then they came out with this problem that people who are sitting more than 8 hours a day without a break, without getting up, and that's very common now. We are just worried about our, targets, our work which we have to do on our laptops and computers, and we just keep on sitting and we don't have time to even get up and talk to people. We don't take time to take lunch. So then they found that these are the patients these are the normal people who are having a higher incidence of heart diseases. And that occurs because of multiple issues. It is not just heart, it is all the multiple factors are involved. So number one, the cardiac issues become higher because now the risk rate of heart attack increases and the stress to the heart is more if you're sitting and if you're not exercising. If you're sitting, then the body's ability to process fat and sugar is limited. It's not there. So you become obese, the blood pressure goes up.
Even if you're exercising 45 minutes a day and then you sit for 9 hours, is it a problem?
Yes. That's why I'm saying that you should take breaks. Even if you're exercising in the morning or whatever time, but if you're continuously sitting, you should get up. You should stretch your legs.
I have a question for you, Dr. Rastogi. You are a doctor. आप भी तो बैठ के अपने पेशेंट्स को देखते हैं. How many times do you get up and say, okay, I'm taking a break? Or for example, you are a surgeon. I mean to say, how do you do that? When I'm asking you, suppose you go to the clinic and doctors have the longest hours, the most unhealthy hours. Actually, if I have to say, is in the medical profession, the doctors. The day can be 18 hours long for them. So then what do you do?
You're very right, because it's very easy to say these things, but then if we just see that what we are doing, we are all in the same boat. And you're rightly pointing out that doctors are not taking care of their health, and doctors are falling sick, and they are having these problems at a rising rate. Especially those young entrepreneurs who have taken over a hospital also, who are more stressed than the normal population. So yes. What I do, I would take a water break. I would just, get up and drink water. I would, whenever there's a phone call, I would just stand up and take this phone call while I'm not sitting. I'll just stroll there. So this is, it is very important that we have to consciously realize that it is bad if we are sitting for long hours. So we should just make sure that every 2 hours we are getting up, we are, taking a stroll, or we are just doing something else, which is not just watching the screen. Okay.
Dr. Dhi, your comments on this, and you referred to one issue, I have also started doing, I've started to do a little more, when I was young, I would always boast in front of my father, I slept for 5 hours and I did this. And my father would always say, don't be stupid, sleep, rest your body. Now all the studies have come out, if you don't sleep, you don't recover, and now lack of sleep and heart has become interconnected. So decode it for our viewers, what sleep does for your heart. People think sleep is only for energy. So gaye, to jaan aa jayegi. But what it does for your heart?
So I'll just start with my previous thing. Okay, why? See, everything, we have a mobile phone, we need a charger, we need to charge it.
Correct.
At a certain point of time. Okay, so that charging of the whole body happens during the sleep cycle.
Okay.
It is the repair of the whole body, whole organs, which is happening during our sleep time. And we should have a good sleep. For a good sleep, we always say that you should, there are many recommendations and everyone can follow its own. Don't drink coffee before that, cut your screen time, wash your feet before going to the sleep and all that. These are all good habits because during that time, our regenerative and I would say whatsoever stress we had given to our cells, the cells will regain its energy and would, I would say, quickly fix those small damages which can be fixed. So what I call is a stitch in time saves 9. So during that sleep hours, all those things which we have, you can say, damaged with our not exercising, with our not walking, with our bad dietary habits, we can just correct it with a proper and deep sleep. And secondly, what I told you about the activity, what you were saying is
yes.
that, okay, so what I do is, I have long operating hours and all that, we wear stockings during the surgery, and so my OPD is on the lower ground. So I don't use lift to come to the second floor. Till 3 floors, I use the stairs. Every 2 to 3 hours or 4 hours after the surgery is completed, I don't come and straight away sit on the chair. Secondly, parking my car at the most distant place from my lift. These are the few. Trying to use the loo on the next floor, not on the floor which you are working. So these are small things. See, actually it appears small, but yes, you have to gradually start.
And last thing, and the last thing before I close, the sort of diet that has evolved in the last 40 years has also changed. In terms of roughage, the processed food, availability of sugar, salt, fat, all together. Like chicken nugget, it has fat, it has got sugar, it has got salt, then it has got MSG, multiple things. Do you think the diet is also contributing in the rising cases of heart failure, inflammation of heart, and the arteries getting blocked? Is that the reason, Dr. Rastogi, that with so many things which are happening, this is adding to the list?
You're absolutely right. The food now is more of, I would say, it's a very quick thing, quick fix. So we are resorting to things which are readily available. We are just ordering food on Swiggy and Zomato, which is very easily available. All the restaurants are open till late night. So people don't want to cook, which is a healthier way of eating, but they would order food which is processed or which is high in these substances which are sugar and oil. So definitely this aspect of our dietary habits, they have definitely caused
do break-in meals help heart? Like the way if you break your meals, it helps pancreas. Does it help heart?
Yes.
Definitely.
Does Dr. Dhi, how does it help heart? People know that if there's a break between meals, your pancreas at the time, insulin will do the job. How does it help heart?
See, heart is the organ which is supplying blood to the whole body, and those are going to digest it. So heart also needs some time. It is pumping regularly.
Okay.
So what I say for the diet is, we have 7 colors of rainbow.
Yes.
Your diet should daily have all those 7 colors in form of every kind of food you eat. That is the basic thing. And secondly, what I say, see, we live in India. We are Indians. we are dal, roti, chawal wale guy. We are not burger, pizza and pasta guys.
Yes.
Secondly, I would say the Blinkit. Aaj dal bani hai. The kid says, I'll just order a Blinkit. Either I'll order a tacos or a burger. That time, this is the generation which we have to stop. We have to tell them that this is the right time, because these things will affect them 10 years later.
Absolutely.
If we stop these kids, and actually we should be teaching kids in the school about these dietary things.
Instant gratification. Instant gratification.
Yes. Yeah.
That is most processed food. Okay, just order. I need a Mexican taco today, and we are okay.
You are so right. I was just thinking, I was small, I would get packed off to Agra, where my father came from, and I would be at my bua's place, and now I realize that when I would be served breakfast and I would say I want to eat something before the lunch, she would say rasoi to band hai, and then I had to wait till 2:30, and then I would have my food, which is dal, chawal, lauki, and then as a child I wouldn't have tea, and I would say dinner khana hai, bhook hai, the rasoi to band hai, let it open after 7:30. So I think I realize now that the points of where I could have food and when I didn't have food played such a big role in I not getting obese and fat, and I was really thin because it was 3 times a day, maybe 4 times a day, but there were and I was not allowed to eat out and go to shops, and it was having such a strong effect on my metabolism that till my late 40s I didn't gain weight, Dr. D. I just didn't gain any weight.
Actually, I also hail from Agra, and I tell you right now in Agra also this is happening. There are a lot of bidai, and which I go for normal OPD, and morning hours you see there, it's full of bidais. After bidai kachori, you have jalebi. That daily thing that is not.
Don't talk about that.
Right? We used to have pakka khana only in the night.
Yes.
That was so many. We used to have रात की रोटी रखी हुई है, सुबह उस पे थोड़ा सा.
Actually, you have talked about bedai and kachori. This is like homecoming anyway. I hope we get to speak after the show, but I really run short of time. Thank you, and I would like to thank both of you, Dr. Vishal Rastogi and Dr. D, because today was the hard day, and I thought this special conversation should happen. That we must take care of our heart, and this is all I had on Point today. I'll see you tomorrow at the same time. Thank you and good night.